The first question is from Joy or Jacobo said that, thank you, Dr. Motai. For those of us in Nigeria, what resources are available for us? I'll come back to Dr. Idiale.
Thank you very much for that question. I will not pretend to know everything that's happening in the community, as I don't live in Nigeria. Actually, I can count on one hand how many times I've been to Nigeria. So I will not pretend to be an expert in that area. But from my research and a lot of Nigerian psychiatrists who I've worked with, I have learned that there have been some difficulties in terms of, the connection and link between the community and the Mental Health Foundation. So I'm aware that there's an Association of Psychiatry of Nigeria who are working with different associate and medical students to advocate for the community out there. But I know that there's still a lot of work ongoing. I know that the WHO, which is the World Health Organization, did put out the law to say we want at least 50% of the African countries to have a law and specific support when it comes to mental health. But so far, we are still getting there as a Nigerian country. Reasons for, if you think of the issues that we have in the UK, you can just multiply them in Nigeria. The reason of stigma is there. So even if it was there, would people go to and use it? How many people would you feel comfortable going to a psychiatrist, going to a counselor? Not to say they're not there, but we don't have that many. And that's why a lot of psychiatrists who I work with here have already worked in Nigeria and then come here and then try and, establish something here to then use over there. But the number of Nigerian Black doctors in general is still very small for the amount of Nigerian population and people in need that we have. The need is there. 80%, more than 80% of people do not have access, and the mental health is definitely, like, without any question, affecting a lot of people without even knowing that it is. So to answer the question of what is out there, I can't give you specific names because I am not aware of like charities that we have here. For example, you can call up Mind, you can call this, you can call that. So I don't know in your local, community what is out there, but I do know on the grand scheme of things, there are organizations that are working. They just need further support and they need that breakthrough to actually establish themselves. So I don't know if maybe any of the other doctors can give a bit more information on that.
Okay. Thank you. Dr. Idiaye, can I just ask, can you just hold on a minute?
Can you hear me?
Yes, we can hear you. Can you hold on a minute? Okay. You are much more an experienced doctor than Dr. Motayo. In addition to that question, another one that was asked is, are the illnesses associated with long COVID a risk to those that are asymptomatic?
Okay, I'll take both. Just to kind of supplement what Dr. Motayo said, which, I must say our presentation was fantastic. Kind of brought very practical experiences to what actually should be done and how, people could assess mental health support within the UK especially. Just regard what's available in Nigeria. I've got, a friend of mine is actually on this platform as we speak, and he joined us based on the invitation I extended out. He's the chief medical director for Federal Medical Center in Abuja, and I know the amount of work he has been doing regarding mental health. Under his leadership, the hospital have signed a private-public partnership with a very strong mental health service to provide mental health service for the people in Abuja and environs. And he's doing quite well trying to see to the mental health needs of the residents in Abuja and surrounding. And I know that, mental health is kicking off big time. And he has a lot of interest in trying to make that, So if anybody is interested in knowing what's available in Nigeria, you can reach out to him. I think he's on this platform. His name is Professor Ahmed Sahad. He's a very He's a very approachable young man. I call him young man because he's my mate.
Sorry, Dr. Diaye, a quick one.
Yeah.
I would want him to speak. This is Q&A. It's important. There are people from Nigeria who've asked questions. And since we have the opportunity of having a prominent person like that, it's important that he participates. So please, Dr. Said, feel free to respond to that question. Thank you.
Yeah, thank you very much for giving me the opportunity to address this house. I thank all the presenters and also the moderators of this particular session. Mental health is actually one of the issues that's quite forgotten when talking about issues of health in general, particularly when you look at when COVID came and all the attention was actually to the physical being, and the lot on the mental health was actually forgotten. In Federal Medical Center, Abuja, at that point in time, we decided to now have a PPP arrangement with some mental health practitioners who now help us to run the mental health services, as well as getting some counseling lines that we are able to reach out to people, some that are even in isolation, through which means they're able to give services to these people who can ordinarily not come out to go for these specialist services. So I thank you for giving me this opportunity to address this house. And I want to tell you that in FMC Abuja, that's Federal Medical Center Abuja, we take mental health care seriously, and we are investing so much in it to see that we have a very strong mental health service. Thank you.
Thank you, Prof. Thank you very much. Dr. Ediaye, do you think the WHO has done enough and or is doing enough in the dissemination of credible information? From Dr. Tony Agbons.
Okay, before I come to that question, I just really want to, one or two words about the long COVID, the asymptomatic patient. I think one thing we have to be very aware of is that COVID is a new disease. A lot is yet to be discovered about this disease. This is the reason we have to be very careful to ensure that, if we can, not to catch it, and if we can, not to give it to other people, because in the future, we do not know what the complications of this disease would be. Because, regarding long COVID, this only been around in less than, very few months. Nobody knew that this was a thing. And even when some people have not been symptomatic, there have been reports of people not being able to taste their food or have, have good sense of smell for months. They didn't really suffer the full COVID symptoms, the full COVID outcomes. They just had loss of smell and loss of taste. And for months, 6 months, I heard of someone who for 6 months is not able to taste her food. That I know would be very distressing for anyone. Imagine not being able to know what you're eating. You're just eating, and part of eating is not just to give us nutrition, but also as a way to, it's a form of enjoyment, it's a form of pleasure. So the long-term effect of COVID is still very much unknown, and if we can, it's something that we should be very careful not to either catch or not to transmit. I don't know if that is able to answer that quite well. Regarding the WHO and the impact, I think this has been a little bit more controversial. And it's not been helped by the outgoing 45th president of the United States, Donald Trump. And they've been, it's turned into a political war, a political arena for trading of blows. Personally, I think WHO could have done better. I don't think they have done as much as they did. So I don't think that they've done as well as they could do. I think, there have been a lot of They've not really taken that leadership role, which we would expect an organization such as WHO to take. It has been either trying to be pro-China, trying to be a little bit, sitting on the fence, or trying to see how they can, please the United States so that they don't pull out of the WHO. So it's become a political issue about COVID, whereas it should stay health issue and not political. So if you ask me, I don't think they've done enough personally. I think they could do better. But I always look at things from a supportive point of view rather than just criticizing. The time for taking stock is going to come. That time is not now. Let's all pull together. We know the shortcomings are there, but let's pull together. Let's work together and sort these problems, and then we can look back and begin to see where things could have been done better.
Okay, thank you, Dr. Egai. There is another question for you and Dr. Motayo, and I think we'll have to include the Dr. Idawo. Says, thank you, speakers. There's mixed opinions that the virus is airborne. Kindly clarify the relationship differences between airborne, TXM, and aerosol droplets transmission. Dr. Idawo, you want to start, please? You're muted.
Oh yeah, thank you. We just like the common cold. Let me break it down that way. We do know that the virus responsible for COVID comes in such a way that it is affected both by temperature and humidity. I made that statement with a lot of caveat, but also that the virus is carried in our saliva and mucous secretions from our nostrils, and therefore how it is transmitted and how it is deposited will depend, one, on the volume of the aerosol that comes out when we speak or when we sneeze or when we cough. The larger and heavier the aerosol, the more likely is that the virus will be deposited on surfaces around where we have spoken. But it also means that where the aerosols are tiny droplets, they could be suspended in the air. These are the information that presently is available. Now, where the environmental factors are conducive, the viruses could survive in any of these spaces, in the air, on surfaces, and the surface, whether it is wood, whether it is metal, or whether it is plastic, for varying periods of time. So when the weather is cold and is humid, as we have in winter, survival is said to be longer. And when it is hot and it is not so humid, it's said that it could shorten the survival of the virus. What all of this means is this, that in terms of transmission, we have to ask ourselves the questions of what we should be doing. There are those people who are anti-face masks, and I think Dr. Ediade pointed to that. When we wear face masks, why are we wearing face masks? Why are we wearing face masks? To cover our nostrils and our mouth. In other words, why are we wearing face covers and not mouth cover? It is because this virus actually thrives in some of the glands deep in our nasal passages. These are the glands where this virus thrives. That is where it really grows. If you cover just your mouth and you sneeze, you send out tiny particles of the virus that could stay in the air for a while. Therefore, the idea of wearing face covering is to ensure that both the larger droplets, aerosols that come from our speaking and our coughing and all that, and from our sneezing by covering our nostrils, is kind of minimized or reduced. So we have a responsibility to ourselves to keep the virus from going out of our own spaces, to protect the people who are around us. I think that once we get that basic thinking right about the impact of the size of the aerosols that come from when we speak, when we cough, when we sneeze, and also the possible impact of the environment, we will better understand why, for instance, there is so much anxiety about this second wave happening during the winter, and why it may be worse than the first wave. I think that is what I would like to probably think with how we deal with it, and also to mention that, having said so, it also means that we need to be aware that these viruses are deposited on surfaces about us. So in your office or in your home, or you make sure you wipe down consistently. I don't think that it is the psychiatrists will probably correct this. I don't think it's an OCD matter to ensure that you wear your face mask as much as it is possible, both indoors and outdoors. I don't think it's too much for you to ensure you wipe down your environments, your spaces, your workspace, your home spaces, as much as you possibly could, because all of these will help to minimize the possibility of picking up the virus. That is how I would like to probably look at that issue.
Dr. Motayo.
Hi, thank you. Yeah, I think Professor Dawal really said everything. The main thing is the fact that whether it is airborne or aerosol droplets, really and truly, we need to protect not just ourselves and others. So without repeating everything that he said, I think it is very important for us to understand how the virus works. And indeed, our respiratory system starts from our nose and mouth. So even without going into the actual scientific things about it, you know, if you were to sneeze, generally speaking, you sneeze, you catch it, bin it, kill it. So you make sure you're catching your tissue in your elbow. You know, if it's in a tissue, you bin it, you wash your hands. So I think this is actually an opportunity for us to improve and encourage ourselves when it comes to our hygiene, regardless of coronavirus, because you will notice how many people are washing their hands now, which makes you question who was washing their hands before. So I think this is a really good, you know, everything happens for a reason at the end of the day. And I think rather than us going into, oh, but why should I cover my mouth? Why not my nose? Why not, you know, other parts of it? Let's all try and use this opportunity to improve our general health. As the first presentation said, it's about your respiratory hygiene, your any kind of hygiene that you can tap into. So this is our chance to be better at that.
So the opportunity that COVID-19 brings is for us to improve and increase our health and our cleanliness. Dr. Ijale, thinking about another question by Tola Oshunuga says, thinking about Nigeria, is there any benefit in collaboration between orthodox and traditional mental health practitioners? And Professor Ahmed, you can also help us with that as well. Dr. Ejai.
You know, I think there needs to be collaboration across board, not just only with the traditional medicine, but also with the religious churches, because we know the role of religion in the role religion plays amongst people in Africa, especially in Nigeria. We're a very religious country, whether it's Muslim or it's Christian, depending on the part of the country that you live in. I think there is need for collaboration across board, you know, traditional, you know, orthodox and religious aspect as well, because if we're talking about mental health, or we're talking about, getting relief from any form of disease, everything has to come together. But then every aspect has got a role to play, and we have to ensure that we keep within the boundaries of our roles and not begin to dive into other people's aspect of roles. For example, if you're going to treat someone, you have to also take into consideration their religious beliefs. You just don't treat people and throw away their religious belief, because it's quite important for them, and it's quite important in maintaining people's mental health. Religion is known to help people, to help to stabilize people's mental health. In terms of traditional medicine, most mental health patients end up in traditional medicine care because, because of the poor mental health services in Nigeria. It is good for people for our healthcare professionals to reach out to these people and help them to be able to refer such people to the right place for care. But if we are talking about using of medication or using of other intervention, there's not been evidence to show that a lot of the interventions being banged around, like inhaling, steam, or some other medication. There's no evidence that this works. People should not take one person saying, "Oh, I took this and I got well," as evidence. That's not evidence. Even placebo, there's what we call placebo effect, which can help people to get better, but that is not evidence that medication works. The only thing that's been proven to be effective, as we know today, is the vaccine. And that's where we should be directing people towards. I know there are talks about hydroxychloroquine. There's no proof that there's no evidence that works. Even remdesivir has been shown not to even be as effective as once thought. So we should be careful not to miss roles. But like I said, religion is quite important. People have faith, and there's been evidence that faith does work. Faith can help to activate, some chemical process in the body that has been shown to help people to get better quicker, and helps people to get quicker. So there has to be an interaction between all aspects.
All right, thank you, Dr. Edere. I would like to recognize Professor Kingsley Akigbe. Would you want to say something briefly, Prof? 1 minute, please. Professor Kingsley. While we're waiting for Professor Ahmed, if you want to say something.
Yeah, thank you. Well, I must say that I'm a histopathologist, just like Dr. Idewo. However, I want to comment on this issue about collaboration between the Orthodox and the traditional practitioners with regards to mental health. Well, in Nigeria, we all know, just like orthopedics cases, most of mental health cases actually go to the traditional medical practitioners before eventually landing up in the hospitals. In view of this, I feel there is need for such collaborations. At the moment, there may not be that platform, but I believe the government can actually make that to happen, both the state government as well as the federal government, through the either Federal Ministry of Health or the state ministries of health. At the moment, I think there is strengthening of traditional and complementary medicine. I think a board is being set up at the moment at the Federal Ministry of Health that will give a platform within which to easily reach out to the traditional medical practitioners for such collaborations. But if we remain divided, whereby the Orthodox are doing their practice on one side and the traditional medical practitioners on the other side, it means there will be a gap. But if we are able to bridge this gap, we'll be able to get the people that actually need these services to be given the required service. So thank you very much.
Thank you very much. So there's need for an all-round collaboration between the traditional, between religious, and also the medical practitioner. So a kind of holistic view. We have about 9 minutes to go. So what I will want to do now is to give a couple of people opportunity to ask questions or make their observation before we give the panel of speakers for them to conclude. A couple of people, please, if you want to ask a question or make an observation, if you can raise your hand so that I can.
Before they raise their hand, let me quickly add here, because yes, it's obvious I'm not a medical doctor, I'm just a lawyer. When you're talking about collaboration, I think it's very important. And one, there has to be legislation, and I think I've listened carefully and watched that. There are a lot of, and I'm biased from a intellectual viewpoint, there are a lot of quacks, unregulated, claiming to be traditional healers, whatever that is. And so for folks like us, I would encourage the federal government, state government, local government, not to have an open book for all sorts of people to come in there and claim to be. How do you regulate them? So these are issues that we should be moving away from. Yes, people may not agree with me, but I don't think I would encourage such things that has no scientific basis. Yes, we are into our tradition and customs and all those stuff, but we must move forward. Except they are regulated, it will be pure disaster. Because I've seen in Nigeria where people are chained like animals, treated horribly in places, whether it's in the south, in the north, all over Nigeria, claiming that they have mental issues and treated them worse than animals. So that's just my little contribution.
Okay, before anybody talks, need to depoliticize COVID-19. Thank you, Haliru, for your message on the chat box. You said, thanks, and how often is this held? We have monthly sessions, but moving forward into 2021, we will be having more regular sessions, and it will be on topical issues. So thank you for attending and welcome. In terms of the question, any observations, any questions before the panel, they give their closing remarks? FA says FMC Abuja, currently headed by Professor, has set up an enviable precedent. Hold on 1 minute. I'm trying to. Yeah, for other medical facilities to emulate. Any further comments? Are there going to be actions through this? Because mental health is realistically affecting a good proportion of population, not just in Nigeria, but even here in the UK and across the world, especially with the current situation caused by the pandemic crisis. A lot of people have lost their jobs, and positive outcomes comes out of this. Niyi, would you want to say something about this? I can't hear you. I think you're muted.
Okay, actually not about what, I can see that Toby has raised his hand. So I guess I think it's he, I guess, wants to speak. Toby, you're muted.
Good evening, everybody. I'm Elaine.
Hi.
Regarding what the lawyer was talking about, because of health inequalities, you find out that a lot of lower income people, they will still go and patronize the quack doctors or the traditional healers. So just I want to support what the Professor Ahmed from Abuja said. There need to be collaborations, because if there is no collaboration, we will still have those problems that we see in Nigeria, where you see traditional healers chaining people because they think it's easier, it's cheaper to go to those people than to go to the hospital. Thank you.
There's one final question. She says, on the issue of vaccine, what is the Nigerian government to make it available and affordable? Also, I heard the test is 50,000. Could that be a reason why there is low testing? I think you can use it as your closing remarks, members of the panel. And I will still call on Professor Ahmed as well. So starting with Dr. Ediaye.
Yeah, so my closing remark is this: COVID-19 is real. This is a virus. It is not a chip. It's not something put there to control or depopulate the Black population. This virus is real, and we have to treat this virus like an enemy. And like an enemy, everybody is to pull together like an army to fight this enemy that's trying to disrupt our ways and has, put normality into a distant future for us. And the most potent weapon we have as of today are the simple measures we've outlined: sanitizing your hand, face covering, washing your hand, good health hygiene, a good ventilation, and vaccine as when it gets to various parts of the world. Avail yourself of the vaccine. Try as much as possible to be very mindful of the information you share, because the information you share could be potentially dangerous to other people. Try and get your information from trusted websites. Try and verify the information you share, because it could be doing more harm than good. That will be my closing remarks for today. Thank you very much.
Thank you, Dr. Ediaye. Dr. Motayo.
Thank you very much. I think in addition, I agree with everything that's just been said. I could just add to the comment of the collaboration in the UK, because that's what I am part of and that's what I can comment on. I can definitely give the reassurance that there is more work being done in the community. We are talking to the MPs about different things that are affecting us, not just in the mental health sector, but even just as Black people. Even in my own local GP group, we have actually established different services to improve things and experiences even for Black people. This is not just affecting others, is also affecting the healthcare. When the COVID-19 first started, we saw how many doctors, how many healthcare professionals were being affected and were dying from this infection. So when it comes to mental health, I do want to remind everyone that also your doctors are as human as everybody else. They are going through their own as well. And it is very important to have that mutual understanding and communication to bring that change. So I encourage everyone to keep washing your hands and do all the basic things we need to do. Do you find out from people in your own community who have that knowledge? Because when it comes to trust, as we've said in different conversations, when it comes to building trust, you will trust the person that you can relate to. Hence why some people are going to maybe different kind of doctors or different kind of help to get better. That is also happening in the UK. Doctors do have that difficulty to help certain people. Even when it comes to, take paracetamol, no, they will just want to drink agbo. So, you have that difficulty with people already. So there is work going on to understand the community that you are actually treating. So it's just an encouragement to everyone. Thank you.
Thank you, Dr. Motayo. Dr. Idao, unmute yourself. Thank you.
Pardon me. Yeah, to say thank you to yourself and your team for putting this together. I think that it's a great community service that you've done. And to say thank you to my colleagues, Dr. Ediaye, Dr. Motayo. I've learned a great deal from you guys this evening. Professor Ahmed from Abuja, speaking from Abuja. It's great to have you on the platform and to know that you are a histopathologist. So it means that we are becoming better connected to the community. Usually we are stuck in our offices peering down the microscope. So thank you so much. I think that the bottom line for all of this for me is getting our people to understand that science holds the key and has been the main driver to the development that we are enjoying today. And science will continue to hold our key to our human survival. And as a people of color, we need to be better driven to ensure that we search for the science that help our problems. I think that it is very important, not just with regard to COVID-19, but on various degrees or kinds of healthcare related problems, which I'm sure that my colleagues will know a lot more better. We need to believe that science is key to how we treat our bodies. Thank you very much.
Thank you, Dr. Idaho. Dr. Ahmed.
Hold on, please. Hold on before Dr. Ahmed speaks. Elena has raised her hand. So, Elena, do you want to unmute yourself so you can speak, please?
Yes, please. Thank you very much giving me word. I'd like to also to say about what I was researching since pandemic started. My mom, she's a pediatric, and since I was a child, I was also reading her books, which we had a big medical library at home, and I was reading ancient book of Avicenna. You know, Avicenna was a father of modern medicine. He was living in Islamic golden age in 10 centuries ago. He was researching at that time already microbiology, and my ancestors, they are also microbiologists and epidemiologists. And that's why I asked the kid to accept me for this conference. So the result of his research of that bacteria, which he didn't know at that time, and nobody could confirm that bacteria were existing. He said that the main thing, which is exactly concern of the subject of this chat tonight, it's a mental condition. So as far as people are feeling fear, and especially group fear, as much that pandemic is enlarging. And they are absolutely necessary to have psychiatrists and coaches who will train population and people to rid of fear, all kinds of fears. And Dr. Amatayo said in her wonderful speech about that it's not only condition of mental condition, concern of pandemic of COVID. Sorry.
Have you finished, Elena?
She should round up, really. Yeah.
Okay.
Okay, let.
Okay, I think she's right. Dr. Ahmed.
Yeah.
Yeah, thank you, Esosa. Thanks, Ni, and Nigeria Business Magazine for this opportunity to participate in this forum. What I would say, I think others have already said so, that COVID-19 is real, and we should be guided in our thoughts and action by science, not emotions, not sentiments, not politics. And we should be able to guide people appropriately as medical practitioners, as scientists, in all the fora in which we find ourselves, because there are a lot of misinformation going on at the moment in the social media in particular. And we should be able to educate the populace based on science. Thank you very much.
Thank you, Dr. Ahmed. I would I know a few people have commented on the comments box about continuity in this. Watch out, the conversation will continue. But I'm going to call on Kede now to give his closing remarks. Kede.
Well, let me thank all the speakers and participants. And I would say, Dr. Ahmed from Nigeria, thank you very much for really putting to rest some of the stuff that we've been hearing. And it's not easy. So I'm happy that your communication, so you're the first that didn't really have a communication challenge with the internet. So I'm happy with that. And thank you to our speakers. As to this event, I listened very carefully, got a lot of education. Some I knew, some I didn't, obviously, if it's medical. So I'm happy that we put this together at very short notice. But what would happen is that we're going to put out the videos and everything that's been said today and disseminate to the wider population. One thing I'm glad about is that we have started a dialogue, and this dialogue will expand. There are a lot of issues that have come up from this conversation, and we need to enlighten our people. And I'm very happy. And it's not even race specific, actually. Everyone has anxiety, whether you're black or white or Christian, Muslim. And so once we remove politics and religion out of serious issues, we go very far. So let me not take too much time, but just to really appreciate the participants, the speakers once again. And come January 2021, which is just next week really, so let me, or this Friday actually, so let me be the first to wish everyone an optimistic 2021. And thank you very much again for joining, and have a very wonderful holidays. God bless you. Thank you.
Thank you, Kede. Thank you, everyone, and have a good one. We see you soon on the 8th of January. Thank you to our speakers. Been very brilliant. Thank you, and watch out. Watch the space. Bye. Have a good bye.